diligently to make this new platform a reality. That being said, we are also happy to announce that qualifying individuals will be able to sign up on a wait list tomorrow morning at 8:30 a.m. on our website. There will be a pop-up box that will appear on KCHD's main COVID page, covid.knoxcountytn.gov, that will take you to the wait list. You must meet current eligibility requirements to sign up. That includes being a healthcare worker, first responders, or those 70 and older. However, the full list of who qualifies, you can see when you scroll down on that page and on our vaccine information page as well. And the phases are outlined, and we're following the state phases. Moving forward, as additional vaccine is received, individuals on the wait list will be contacted for available appointments in the order in which the name appears on the list. For those who don't have a computer or internet access, you may still sign up on the wait list by calling the KCHD Public Information Line, 865-215-5555, or calling 311. We are grateful to 311 for providing their assistance as they have larger capacity to receive calls. Once again, the waitlist won't be active until tomorrow morning at 8:30, so please don't call today and ask to be added to the list. This waitlist is through the health department. However, we are working with other local vaccine providers in order to accelerate access to COVID vaccines. So there will be times when we work with a community provider using the wait list to fill vacancies they might have on a schedule that they've planned. We also encourage you to look for those opportunities. There are others who are vaccinating. Pay attention to the news, websites, other things, and they're putting information out on social media. So please take advantage of an opportunity to get vaccinated if you qualify and one presents itself. Don't wait to be contacted through the wait list. Through this waitlist platform, qualifying individuals will also have the options to add their names to a standby list. This list will be utilized if there is leftover vaccine at the end of an event that we need to immediately use. If you are interested in signing up for this list, you will need to be readily available to come to the health department or another centrally located location to receive the vaccine as soon as you are called. It's important to remember that demand for this vaccine is still incredibly high. There are more than 52,000 people in Knox County who are over 70 and older. And that doesn't even factor in the other eligible folks in the first two priority groups. That said, we expect there to be thousands of names on this wait list. We want to be clear that it will take time and significant vaccine supply to work our way down the list and get everybody vaccinated. We will continue to vaccinate as quickly as our supply and resources allow. But depending on how long the list gets, there's a good chance that you could be waiting for a while. So please, again, we're asking patience. This week, we continue to provide second dose vaccines to those who received their first dose through KCHD at the beginning of January. We are also providing second doses to those living in congregate settings with developmental or intellectual disabilities. This is a priority group as identified by the state and is one that we, public health, are responsible for vaccinating. Because of that, it requires our team to go out to each congregate setting to provide these vaccinations. Because of that, it will take more time and resources for our team to vaccinate this group. So you should expect to see a lower increase this week for the number of vaccines administered internally by the health department. There are other opportunities to receive first dose vaccines this week through other providers across the community. We are encouraged that more opportunities outside of public health are coming on board to provide vaccinations. So again, be on the lookout for those appointments from some of our community partners. If you're able to take advantage of those appointments, please do so. For an updated look at vaccine numbers across the county, you can check out our vaccine information page. We will be updating the data every Tuesday and Friday. On this page, you can see that more than 56,000 vaccinations have been given in Knox County. Here at the Knox County Health Department, we've administered 13,000 vaccinations. On this page, you can see how they're broken up into first doses and second doses. as well as viewing the demographic breakdown of vaccines administered across the county. Now moving on to the local COVID situation. We have 81 new confirmed cases since yesterday, 2,302 active cases, 62 Knox County residents are currently hospitalized, and very sadly, we have 2 additional deaths to report, raising our total to 502. As we hit yet another devastating milestone, more than 500 deaths related to COVID, we continue to remember those we've lost. Please continue practicing the 5 core actions in all situations, regardless of whether or not you've been vaccinated. These actions, coupled with increasing vaccination efforts, will help prevent more families from losing loved ones. And now I'll open it up for questions.
All right, the first question we have submitted by our media colleagues is from Cole with WBIR. He says, can you clarify, will KCHD partners such as UT Medical Center or Summit Medical use the wait list when filling vaccination appointment slots?
We will be sharing that on a limited basis. If say they've planned an event and they haven't filled all their slots, which is really uncommon, then we might help them fill those slots from the wait list.
From Jeff with WATE, which provider did KCHD go with, and can you share contract details with us?
I believe that the company is called Luminaire. The contract has been made available. It's a public record.
From Cole with WBIR, how does Knox County track how much vaccine it distributes / directs to partner organizations?
So here's kind of how it works. I think I've run through this before, but the federal government decides how much vaccine they're going to allot to the state of Tennessee. And then the state of Tennessee looks across all of the counties in the state and decides how much they're going to allot to each of those counties based on population, demographics, and some other things that they consider. And then we are informed of how much vaccine has been allotted to the county. And then we work with our partners to know what they've ordered or what they're asking for. And we try to distribute that as equally as we can, making sure that we have what we need to do our first doses. Partners are not being asked to save second doses. These are all first doses. That's all they're for. So they're able to give all of those doses. And I think it's important. I mean, we were talking this morning here at the health department. Right now, we have about, give or take, 600 doses that we don't exactly have a plan for, that aren't either a second dose for somebody or we already have a clinic planned for, but we're making plans for that clinic. So I think that speaks well to the fact that we're getting these doses and getting them out into the community as quickly as we can.
From Jeff with WATE, going forward, will these vaccinations happen at Dameron Avenue, the Expo Center, some new centralized site?
Yes. So vaccinations, we will be vaccinating people. We'll continue to do small clinics here for folks. It's been such a nice thing this week to see some folks coming back for their second doses who are more medically frail. So it's really nice to see. And our staff is enjoying serving those folks and being able to vaccinate them and protect them from COVID. But we'll also be doing larger throughput clinics at the Expo. We're also considering another site, looking at that. And we'll probably do some other community-based events at, maybe a church or a senior center in a place where, it's not just having space, it's having space that's adequate for what we need to do. We need to put several people through this space in a timely fashion while maintaining social distancing and safety for everybody. And we have to have enough parking, and we really need a place so they can go in, go through the clinic and exit so they're not crossing traffic. So it's a complicated event to put on even a small vaccination clinic. So it takes a specialized space.
From Megan with WBLT, what percentage of the population would need to be vaccinated for the mask mandate and social distancing guidelines to no longer be necessary? And does KCHD have a projected timeline for when that goal could be reached?
So I'll answer that in a couple different ways. One, recommendations continue from the CDC that mask mandates and social distancing and limiting gatherings need to continue to be in place. So some of that guidance will come from the CDC. And then the Board of Health will take that information based on our local situation and make further recommendations.
From Ally with Knox News, some counties have begun vaccinating teachers. When will Knox County begin vaccinating teachers and child care workers?
We will begin vaccinating teachers and child care workers when vaccine supply allows for that, and when we have satisfactorily met the need of the 1A1 and 1A2 groups.
Also, a follow-up question from Ally was, how many vaccines will the county set aside for Knox County schools staffers, and how is KCHD preparing for this?
So, we have talked about this with our partners about how that'll look. And we will be designating vaccine because we'll still have to be vaccinating the 70 and older folks as well. So it's not like all these other groups go away. You just add the teachers to the pot. So some of our partners are going to be partnering with, that's a lot of partnering, with the schools to help get their staff and teachers vaccinated. And those plans will be worked out by them, not by us. We will allot vaccine as we can to get those groups vaccinated. But we haven't really ever set aside vaccine and said, this is just for this group. We've done some closed pods at the beginning to get some folks vaccinated. So we'll work with the schools and we'll work with our community partners to facilitate that. Having closed pods for teachers and school staff is not off the table. You have to remember it's childcare, private schools, public schools, and those who care for disabled children at home are also in that group.
From Cole with WBIR, a follow-up to his previous question, how do you track exactly how many doses are directed to partners?
Yeah, spreadsheet. Sorry. So we have a spreadsheet, and the state tells us who's been activated to receive vaccine, and then we get told a number. They ask for a number based on how many people are asking for doses. They may get their full ask on a week where we get enough vaccine, but they may not always get their full ask, and they all know that. They're all happy just to receive vaccine. And then those are shipped directly to those providers. They don't come to us. We don't redistribute them. Those go straight directly to those providers. And we're using a spreadsheet to help us keep track of that.
From Ally with Knox News, if wintry weather causes driving conditions to be hazardous, how will KCHD adjust clinic schedules? If this would happen, how will patients with appointments be notified?
Well, we'll notify people just like we always do when we have to close, using our media partners, announcing it on TV, radio, other ways. We'll put it up on our social media platforms. If we have time and are able, we do make phone calls sometimes when we have to close. That's usually if we close early, but all those different outlets where we put information out there, the website, social media, and our traditional media partners are the ways we notify the public.
Another follow-up from Cole for his previous question. He says he understands how, I guess it works broadly, but does KCHD track the actual numbers week by week to partners?
Yes, we do, because they ask us, they have to order weekly and we get a number weekly, and then we advise the state what to send, how much to send to which partners. So yes.
From Jeff with WATE, once someone gets on the wait list, will they know roughly where they are in terms of being at the front or the middle or the end of the line before an appointment date is set?
Unfortunately, no, there's not a way to know that. It is, again, asking our community for patience. Being on the wait list simply means that we have a list of people that we know want to get vaccinated, that we can reach out to when we have vaccine available. We also understand there will be thousands of people on that list. And again, if you put yourself on the wait list and an opportunity arises for you to get vaccinated and you qualify, go get vaccinated. The wait list is not a magic bullet. It's not a silver bullet. It's not going to solve all of this. It hopefully will give some people a little bit of peace of mind that they're on a list, and we will reach out when we have vaccine available.
Also from Jeff with WATE, can you elaborate a bit on the call-in component of the wait list? Is there a way to keep those callers from winding up at the bottom of that list?
So it depends on when they call in. So when they call in, what will happen is either a 211 operator or one of our phone bank people will go to the website and put their information in and pop them in there, just like you do at home.
And just to clarify, it's going to be 311 or
I'm sorry.
our public information line. And it's just going to be a living list. I mean, it'll constantly just evolve with more people adding their names to it. There's not a set time that we're closing the list.
Oh, no. It won't fill up.
Yeah, it'll just keep on going. From Allie with Knox News, are there any punishments like fines in place if someone were to lie to get vaccinated early?
No. It has happened sometimes. So we ask people to bring their a form of ID that proves that they're 70 or older, or their employment ID that proves that they have this job that requires them to be vaccinated or puts them in the category to be vaccinated. But there are some groups, like, for instance, disabled adults or disabled adults that live at home are in this group. And, so we do trust people to be honest, but there are times when people are asked to come back later or sign up at a later time, politely told that they don't qualify and they'll have to get vaccinated later. It's rare. People are being honest and understanding. People are just grateful to get vaccinated. Going to a vaccine clinic is like, it's like this bonus of happiness for us right now, because that's what people want and people are happy to be there. People aren't happy if they get told to go away, but for the most part, they're understanding.
From Claire with WUOT, can you estimate what percentage of the total vaccine doses allocated to Knox County were distributed to community partners this week?
Not off the top of my head. Sorry, nope.
And also from Claire, can you provide the names of some of the community partners that have received the largest shares of vaccine this week?
No, in an effort to protect their phone systems and their websites, we have learned from experience, we'll let them announce the way they want to announce that they're going to be vaccinating people.
From Cole with WBIR, any more progress towards securing the old Food City off Broadway as a vaccine center?
Well, the contract is on commission for approval this month. So I would say yes. It continues to move forward.
From Allie with Knox News, what's the impact of vaccination efforts on KCHD's other services? As we've talked about, we are limiting some services. We're not doing as many family planning visits. We're not doing as many STI visits. We continue to have our TB clinic and our HIV clinic. So we are continuing to serve people in a limited capacity. And some things that we do have moved to virtual, like WIC. WIC is now virtual and their participation is higher than it's ever been. So I'm not sure if they're going to, they probably will go back to in person, but it's really worked well. And our home visiting programs are now virtual, and the parents, the families like that. Our staff likes it. So it's really been kind of cool. They've been able to keep doing the things that they do. But again, a lot of our staff are still really focused on the response. And right now the response is mainly about vaccination. Also a follow-up from Allie, would more volunteers allow KCHD employees to offer services on a regular schedule again?
We're continuing to increase our volunteers, and if anybody wants to volunteer, I don't know the website off the top of my head, but we can make sure it gets sent out there. You have to register to volunteer, and we are using volunteers, which is allowing our staff to do other things. But what is also allowing us to do is build bigger teams, build more teams that can enable us to be in different places at different times, helping a partner vaccinate or doing a vaccination clinic and other things. So we're trying to make the best use of our staff and our volunteers to make sure we're focusing on vaccinating people as quickly as we can.
From Cole with WBIR, to clarify regarding the wait list, people are on the list as first come, first serve, correct? There's no priority within the current phases.
There's no priority within the current phases. That's correct. First come, first serve. They have to qualify in the current phases to even get on the list, because that would have been really complicated to have to go through the list and decide who qualifies and who doesn't. So there's some questions that will get asked about whether you qualify.
From David with WVLT, are you encouraged in the numbers from the long-term care after vaccinations now that we are 4 weeks in?
Sure. I mean, my understanding is that a lot of the long-term care facilities have been vaccinated. that now I think they're moving through the assisted living facilities to get those vaccinated. So that's encouraging. Those facilities recently have had, several cases, and we're encouraged to get their staff and their residents vaccinated to improve safety at those communities.
From Jeff with WATE, do you know of anyone who has gotten the vaccine in Knox County and then come down with COVID-19?
I'm being told yes.
It's happened. This is Charity in the background. Sorry. We have had a few of those instances where people have had a positive case after their first vaccination between first and second.
Right. So, the way that happens is somebody gets exposed to COVID before they get vaccinated. They don't know they got exposed. They get vaccinated. It takes a couple of weeks for the vaccine to become active and start helping defend you from COVID. So in that time frame, if they got exposed, got vaccinated, the 2-week incubation period of COVID, then they could still come down with COVID. It happens with the flu every year.
From David with WVLT, when the wait list opens, will we be able to see the total number that are waiting?
No, sir. No.
All right, any further questions, please go ahead and submit them. All right, I'm not seeing any other questions come in, so thank you all for your time today, and we will be with you again for our media briefing on Thursday at 12:30. Have a good rest of your day.
$0.55 for Latino women. And a new report projects the wage gap will likely widen by 5% because of this pandemic.